Welcome back. The Biden administration is expanding mental health services in schools across the country. It comes after the Journal of American Medical Association Pediatrics found depressive and anxiety symptoms among young people doubled during the first year of the pandemic. Data from the CDC also shows these issues are still persistent, with 44% of high school students reporting feeling sadness or hopelessness during the past year. Chief Social Impact and Diversity Officer at Headspace Health, Wisdom Powell, joins me live now for more on this. Wisdom, thanks for being here. How significant are these numbers, and what kind of resources will be made available to try to combat this?
So it's great to be back, Diane, and I think this is such a long overdue intervention from the federal government. We've all been bearing witness to this uptick in mental health crises among youth since the pandemic took hold of our globe. And what these services or supports will do is bring more training, more wraparound supports for children that also extend outside the school, and also increase the knowledge, tools, and resources available to educators in school spaces so that they can increase their capacity to recognize mental health conditions and symptoms.
Now, health officials say trauma was a contributing factor to youth mental health symptoms during the pandemic. Can you explain what that means and what it looks like?
Absolutely. What we know for sure is that the pandemic, coupled with increased upticks in racialized violence and political uncertainty, economic crises, you name it, our children have been exposed to a plethora of conditions that could potentially produce trauma. Now, trauma can represent itself in myriad different ways for children. It could show up as more anxiety, difficulty sleeping, trouble concentrating in school, and it can also show up as physical symptoms. As we know, younger children have a tendency to feel trauma in their bodies. And that means that we have to have a sharp eye on the ways that those symptoms can present for children because there's so much individual difference.
So, Wisdom, how can parents help their children as they cope with these challenges?
I think that we need an army of support here. This really is village work. For parents, I think it's really important for us to pay attention to the subtle differences and changes in our children's behavior. This is particularly important because there are gender differences in the ways that symptoms present themselves in children and in adolescents. So keeping a sharp eye on what's showing up differently for your child day to day. Are they sleeping more than usual? Are they losing interest in things that would normally bring them pleasure or joy? Or are you also noticing an increase in reports of like headaches or tummy aches, the kinds of things that children can point to that can signal that something might be going on in their interior lives? But here's the challenge. Supporting our parents will require us also creating wraparound access to resources that don't require them always to intervene with clinicians, which is why this legislation or this set of policies and funding are so important, because they recognize that we need social workers, school counselors, and even resources, again, that are available in our communities to really address this emerging mental health crisis.
All right, Wisdom Powell, always great to have you. Thank you.
Wonderful to be here.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.